So let's answer the big question today. What is lymphedema? And that's a great question because you know when something is swollen, right? You can see it, you can feel it, but does that mean it's lymphedema? Are swelling and lymphedema the same or are they different? Well, lymphedema is actually its own disease state that is an accumulation of protein-rich lymphatic fluid. And it is this protein-rich fluid that determines a lymphedema from any other type of edema or swelling. And lymphedema is broken down into two categories, primary and secondary. Secondary is a little bit easier to explain, so I'm going to start there. Secondary lymphedema happens when we have a known trauma to our lymphatic system, such as lymph nodes being removed, lymph vessels being torn or cut, or radiation to the area. Now, this prevents our lymphatic fluid from flowing normally, and it can cause this backup of fluid, and this type of backup of fluid is known as lymphedema. Another type of secondary lymphedema is from chronic venous insufficiency, or CVI. And CVI is its own disease state in which the veins can no longer effectively push blood through our venous system. And there are a variety of causes for CVI, which I'm not going to get into for this particular video. But anyway, this backup of fluid or pooling of fluid is normally seen in our legs and feet. And eventually our lymph vessels in our feet will be overworked, and they can no longer push out that extra fluid as well, and that can also lead to a secondary lymphedema. That's the most basic explanation, but there it is. Now let's talk about primary lymphedema. So primary lymphedema is a problem with the lymphatic system on its own. So you may be missing lymph nodes, you may have too few lymph vessels, many disorganized vessels, and of course genetic mutations that can all lead to lymphedema. So a baby can be born with lymphatic issues and may present as swollen at birth, but you may also have the problem and it can go unnoticed for many, many years because our bodies are smart and it can accommodate to an impaired lymphatic system for a really long time because our body's just adjusted to that. But then things like hormonal changes or traumas that seem small could occur, such as spraining an ankle, and suddenly you're swollen and your lymphatic system can no longer accommodate this increased fluid, and boom, it never goes away and you're diagnosed with lymphedema. And it's because your body makeup is different and you didn't know it. And most people don't know about these issues until they have such an injury and it just never gets better. The swelling never seems to go away. So if we go back to the initial question, if a body part starts to swell with no known cause, you first have to rule out things like a blood clot or a tumor or anything else really significant and dangerous. If those are all ruled out, it might be time to consider lymphedema. But also remember, any injury to our body is going to swell. That's our body's normal response. But normally, our body will heal and improve in 4 to 6 to 8 weeks, give or take. When the swelling doesn't improve and it becomes thick or it starts to spread or get worse instead of getting better, and again, DVTs or blood clots or tumors or other injuries have been ruled out, that's when it's time to consider lymphedema. Lymphedema is almost always diagnosed once everything else has been ruled out. So all lymphedema is swelling, but not all swelling is lymphedema. I also want you to consider that if you have any sort of significant injury or trauma that involves bleeding or bruising, soft tissue damage, muscle damage, ligament or tendon tears, you can also assume that there has been damage to your superficial lymphatic vessels. And this is why lymphatic drainage is such an amazing and effective treatment for so many orthopedic injuries. But again, as with all other tissues in the body, lymphatic vessels can heal, and you should have a full recovery and resolution of your swelling if you do not have lymphedema or other known issues with your lymphatic system. You can refer to many of my other videos for more information on any of that, including the diagnostic tests that are used to diagnose lymphedema. But remember, the sooner you address any swelling and treat it, the better off you will be, whether that's non-lymphedema swelling or lymphedema itself. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart.